Have you ever taken two medicines at the same time without thinking twice? Maybe one was prescribed by your doctor, and the other was something you picked up at the pharmacy. It seems harmless, but in some cases, combining medications or supplements can increase the risk of side effects or change how well a medicine works. Hi, I'm Dr. Sarah, and welcome to Health Simplified. Today, we're talking about 5 medication combinations that should always be reviewed with your doctor or pharmacist. These examples are meant to help you understand why medication reviews matter. They are not a list of medicines you should stop taking. Let's get started. Combination number 1, blood thinners plus pain relievers. Millions of Americans take blood thinners every day for conditions such as atrial fibrillation, blood clots, or after certain heart procedures. At the same time, many people reach for over-the-counter pain relievers when they have a headache, back pain, or arthritis. The problem is that some pain relievers, especially certain non-steroidal anti-inflammatory drugs, NSAIDs, can increase the risk of bleeding when taken with blood thinners. This doesn't mean the combination is never appropriate. In some situations, a healthcare provider may recommend it and monitor you carefully. But it does mean you should never assume that an over-the-counter medicine is automatically safe with your prescription medication. Before taking any new pain reliever, check with your pharmacist or healthcare provider.
Combination number 2, certain antibiotics plus antacids. Here's another interaction that surprises many people. If you're taking certain antibiotics, swallowing them at the same time as antacids, or supplements containing calcium, magnesium, iron, or zinc may reduce how well the antibiotic is absorbed. That means the medicine may not work as effectively. In many cases, the solution is simply to separate the timing of these products, but the correct timing depends on the specific medication. That's why it's important to read the instructions and ask your pharmacist exactly how to take your medicine. Why medication reviews matter. Every time you start a new medicine, ask yourself one simple question. Could this interact with something I'm already taking? That something isn't just prescription medication. It also includes over-the-counter medicines, vitamins, herbal supplements, sleep aids, cold and flu products. Many people forget to mention these, but they can also affect how medications work. The safest habit is to keep an up-to-date list of everything you take and share it with every doctor and pharmacist involved in your care.
Combination number 3, certain blood pressure medicines plus potassium supplements. Many people take medications to help control high blood pressure. Some of these medicines can increase the amount of potassium your body keeps. If you also take potassium supplements or use salt substitutes that contain potassium, your potassium level may become too high. High potassium may not cause symptoms at first, but in some cases it can affect the heart's normal rhythm. This doesn't mean everyone should avoid potassium. Your body needs it. The important point is that the right amount depends on your health, your kidneys, and the medications you're taking. Always ask your healthcare provider before adding a potassium supplement or salt substitute. Combination number 4, sleep medicines plus alcohol. This is one of the most common and most dangerous mistakes. Some people think, it's just one drink, it won't matter. But alcohol can increase the sedative effects of many sleep medications and some anti-anxiety medicines. Together, they can cause excessive drowsiness, poor coordination, slowed breathing, and increase the risk of falls or accidents. Even if you've taken the medication before without problems, adding alcohol can change how your body responds. The safest choice is to follow the instructions on your prescription label and ask your pharmacist if alcohol should be avoided with your medication. Don't forget about supplements. Here's something many people overlook. Just because a product is labeled natural doesn't mean it's free from interactions. Some herbal supplements and vitamins can change how certain prescription medicines work. That's why your healthcare provider needs to know everything you take, not just prescription medications. A complete medication list helps your healthcare team identify possible interactions and keep your treatment as safe and effective as possible. One simple conversation with your pharmacist can sometimes prevent a serious medication problem before it happens.
Combination number 5, multiple medicines that contain acetaminophen. This is one of the easiest medication mistakes to make. Imagine you have a cold. You take a cold and flu medicine. Then later, you take a pain reliever for a headache. What many people don't realize is that both products may contain acetaminophen. When you accidentally take more than one medicine with the same active ingredient, the total dose can become higher than intended. Over time, taking too much acetaminophen can increase the risk of serious liver damage. That's why it's so important to read the active ingredients section on every medicine label before combining products. If you're not sure whether two products contain the same ingredient, ask your pharmacist before taking them together. 3 simple rules for safer medication use. Before we finish, here are 3 habits that can help reduce the risk of medication problems. Rule number 1, keep an up-to-date list of every prescription medicine, over-the-counter product, vitamin, and herbal supplement you take. Rule number 2, before starting anything new, even a common pain reliever or cold medicine, ask your doctor or pharmacist if it could interact with your current medications. Rule number 3, never stop or change a prescribed medication without speaking